Good to see you. So sorry, I'm a bit discombobbled this morning, but it's good to be here, and I'm happy to talk to all of you. Just a quick slideshow. Lots of folks have asked me kind of what my plans are for DCS, so I put a few slides together that might just help me articulate that a little bit. It's early on, and I will say we're a bit in the assessment phase still of working with local offices and seeing individually what their needs are and how we can support from this lens. So I'm Jennifer Dorfmeyer. I'm a licensed clinical social worker. I have been with DCS on and off for 20 some years. So back in 2003, I was a case manager and worked through the ranks and left in 2014 as an executive. I have worked in the private sector as an administrator for Choices Coordinated Care Solution, if anybody has heard of that. But I worked through their Ohio and Indiana offices, and I also have some credentials in social work as well as substance use. So it's a little bit of my history. I'm also was a licensed foster parent, and I adopted my son from the foster care system. And so I kind of have all sort of different angles to this system over the past 30 years. So excited to jump in and see where it all leads us. Just to level set a bit, in April, this is all public dashboard information, so nothing new and exciting here, but it just kind of talks about the scope of what children we're caring for at this moment. And so I don't know about you, but when I read 13,232 kids, it kind of makes my head spin a little bit, but that is the number of kids that are in need of services as of April. And out of that, 4,314 are in out-of-home care or in-home placements, and 8,978 were in out-of-home placements at that time. That does include those that are in kinship care, as well as traditional foster care and congregate care. 450 days in care average, and a little over 20,000 hotline reports. The 450 jumped out at me because when I left in 2014, this was nearly triple the number. So I think that the system's done a lot of work in this area. So I was glad to see that. So one of the things that we will be working through is aligning with the federal Home for Every Child initiative. And it seems a bit deceiving in that it sounds like a recruitment effort for foster parents, which is certainly a part of that. But the bigger piece of this is making sure that children, the right children, are receiving the right care at the right time. So it looks at how are we intaking children? Are they in care appropriately, or should there have been preservation efforts? So it really pushes a lot of efforts back to preservation and prevention. And I think for this group in particular, that's important because we'll really look at how do we work with those that are inherent in the community that can help us preserve families early on, so prevent removals. It talks about how do we make sure those that are in kinship care first really receive that family connection. And then if necessary, we move to foster care and congregate care. And so it looks at that child as the denominator, and how do we make sure we reduce the denominator to those kids that actually need to be there versus the pool of kids that may or may not. There may have been other solutions that we could have found. Let me see if I hit everything. One of the things that excites me about this is that the federal government's setting up an opportunity for us to see month-to-month data that is side by side from every other state. In this moment of time, all the data that we see is well over a year old. And so when you're looking to compare or even to shamelessly steal good strategies, it's old. And so now we'll be able to look at our data next to everybody else's data and be able to see, hey, over in Kentucky, they have a really great number of the length of time and stay. What can I do to maybe take from them and use here? And so I think this will be a really good opportunity for us to collaborate as well. We also will receive federal technical assistance as well as some funding opportunities. I don't know if any of you have seen some of these, but currently they are asking if any of us are interested in putting in predictive analytics. And so I'm not techie, so I needed somebody to tell me what this means. But what this means is it offers software that will help us look at what risk factors may be in existence, and it balances with the human factor. And so one of the softwares that I looked at was it showed like a gas meter. And so if you had mentioned case mind the case, and if you had mentioned domestic violence so many times, it would click over to a high risk area, and then you could click that button and it would show you how many times you had said domestic violence. So it made it easier to see the risk. And I think for our case managers, that would be very helpful. And then one of the things that I think is no surprise from the perspective that I am a licensed clinical social worker is that I am really in tune to the services that we are contracted with and working through on a daily basis with our children to make sure that we are providing the right interventions at the right time. And so we're looking at utilization. I'm really looking at family preservation services and how can we up our game there, make sure that they're available for us early on in the assessment phase so that if there is a family that could successfully be preserved, that we're able to work with our providers to jump in pretty quickly so that we can mitigate what risks happen sooner rather than later. Also looking at home-based casework. We have a lot of home-based casework being done, and I'm trying to determine, is it appropriate or are we using that as a basket to throw everything in? And so as I'm looking at it, it looks a bit like we're using it for transportation and childcare. And so kind of picking things apart to make sure that we're naming it for what it is and providing the exact right service when that child and family needs it. The other thing that we are working on is looking at residential treatment for our children and using our licensed clinical folks from the very beginning to help identify which children are appropriate, which treatment centers are appropriate, and then clinically follow them from entry all the way to exit so we can make sure that our discharge plans are also appropriate. At the current state, our case managers are those that are standing in for these youth and care coordinating that from the beginning to end. So I'm hoping that this will give us a little bit more clinical insight and just help that run a little smoother, not just for our children, most importantly for our children, but also for the facilities that are working with us. So that's kind of what we're working on right now. There's probably a million other things, but that's the highlight of where my focus is. Does anybody have any questions? Let me stop sharing here.
Yeah, thank you, Jennifer. For anyone unfamiliar, we can do questions just by unmuting, or if you feel more comfortable utilizing the chat feature, we could wait a few moments for any questions to arise.
Hi, Jennifer. My name's Dottie Fuentes, and I'm with the Northeastern Center. Welcome to your new role. I'm curious about the work that's going to be done or the analysis in individual counties, because it seems like there are some counties that are way more open to family preservation, and there are others that just stick with the traditional path in spite of our clinical recommendations when working with families. So wondering if you guys are setting any performance measures or how you're going to do that to get all of the counties on board with family preservation.
Well, so the answer is yes, but I can tell you that we're not fully there yet to figure out exactly what metrics are there. Right now, we're just generically looking at how many in-home cases versus out-of-home cases are in each county, because that's telling. If you really think about it, you can see, where mindset is by just looking at the aggregate data. And candidly, we're looking at what I call the hot spots, some of the areas that have more out-of-home trends, more urban areas where we have higher turnover too. So I'm thinking about how do I organize our clinically oriented providers into the office a little earlier on. So there'll be more to come on this, but we're at the very beginning. But I would look to Vanderburgh County, Marion County, St. Joe, some of these larger hotspots, because honestly, the more organized we are with our prevention efforts, the more supportive that is also to the frontline staff. So I think it has a secondary effect of helping us retain good staff. So just keep your eye on that. You'll see more as we roll through.
Yes, hello. My name is Art Fuller from Hamilton Center. Thank you very much for your time in the presentation. You were talking a little bit about the predictive analytics, and would love just to hear maybe a little bit more about that. Provide kind of one example, but I know that more and more things are kind of headed that way. If you just had any additional thoughts on how that might be used or planning going forward.
Well, I am probably the worst person to give you any technical advice, but I can tell you from sort of a dummy perspective, what I've seen is the software that we're looking at really does a great job at looking into what's already there. So it's not giving any advice, because I think that's where this gets a bit scary. But what it does is actually go back into the history of what's already in the documentation and just highlights the risks. So say you have a family that has been involved with us on and off for 10 years, it's going to look through the documentation for you and pull up as many. I think you can set it to say, pull up domestic violence, pull up substance use. And so it highlights the things that you train the program to ask you to show it. Now that, don't hold me to it because we're not there yet. And that was just released to the federal government in the last couple weeks. So again, we're pretty early in to look at what it actually does. But the couple of demos that I've seen, that's what it does. It sort of takes a look backwards for you and helps you identify. It makes the risk factors jump out. And I'm hoping that it also does that with protective factors as well, but I'm not confident in saying that.
Okay, thank you.
I am also the person that has my 8-year-old look at my phone for me. So take that with a grain of salt.
Any other questions? And then also just a little plug for our July 8th through 10th conference in Fort Wayne. We will be opening up registration for that this week. We will have DCS there speaking as well for our youth focus conference.
If there isn't questions, I guess the one thing that I would hope this group would know is that my intention is to be collaborative and transparent. I am kind of both a provider and a DCS person. And so I think uniquely I'm able to speak all of the language. And so I know in the past that's been difficult for all of us, where one side speaks all safety, the other side speaks more of a mental health type slant. And so I do feel blessed to be able to pull all that together. And I'm hoping that this opportunity to work with all of you, especially in the community mental health space, I think it'll be a unique opportunity to kind of help us come together and serve families. So I'm excited about working with everybody, and I appreciate this opportunity.
Yeah, and you're getting lots of thanks in the chat. So everyone's echoing everything that I've been trying to express this morning as well. We appreciate you for being here. And yeah, congrats on your new role.
Thank you. Thanks. Yeah, I will hopefully have by the next meeting a lot more information to share. We're just getting started. So we'll talk more soon.
Great. Thanks, Jennifer.
Thank you. Have a good day.
You too. Thank you. So now I'm going to go ahead and get into just some updates, some save the dates for your calendar. We do have our June 18th, for those on the line, CEO retreat. And then following the next day, our board is aware we also have our annual board retreat on June 19th. We also have our quarterly Connect Hub coming up on June 25th. So I believe Leanne has sent out a QR code for that registration. It's psychological safety, so be sure to register for that. As I mentioned before, you can see all of our events, such as upcoming conferences and committee meetings, on our events tab of our website. So we do have July 8th through 10th in Fort Wayne. That is our Youth Focus Conference. Registration will be opening this week. Leanne just put the link for the QR code for the Connect Hub in the chat, so you can pull that from there. And then we will get back to our regularly scheduled Cup of Joes. So as always, if you want to put holds on your calendars, it's the second Tuesday of every month at 8:30 a.m. Eastern Time. And we do always use this same link. So if you just want to create a reoccurring hold on your calendar. And I think those are all my big event announcements. We do have a drawing for our Starbucks winner. So Dottie at Northeastern. Oh, that was a nice surprise, ACI. Congratulations. Yeah. So if there is nothing from anyone else, just a reminder that we do record these and we house them in our members only area of our website. But just another reminder and announcement, if you didn't see, I sent out last week, yes, second Tuesday of every month. If you did not see my email from last week, we are going to a new member software. It is called Glue Up. And so you will notice that future communications, such as announcing that conference registration is open, as well as registering for the actual conference, will be on Glue Up. So things are going to look a lot different. So just make sure that you save Glue Up as a safe sender in your emails. So without further discussion then, I think we've covered our Dunkin with Denise this morning. So kept it short and sweet. And if everyone wants to raise whatever they got in their cup up, and cheers, everyone. Happy summer. Thanks for being here. And we will see you soon. Enjoy the rest of your week.